The CDC has announced that the government will release some monkeypox vaccines from the national stockpile as more cases are reported here in the U.S. The vaccines will only be available for a small number of people, though. ABC News medical contributor and Stanford Children's Health physician Dr. Alok Patel joins me live for more on this. Dr. Patel, thanks for being here. 7 people in the U.S. are now confirmed or presumed to have this virus in 5 states. Officials say one patient is isolating at Bellevue Hospital here in New York. So what do we know about this, and who is eligible for this vaccine?
Well, good morning, Diane. The quick answer to what do we know about this is fortunately a lot regarding the actual virus, because monkeypox, part of the smallpox, the same viral family, has been studied for decades by scientists, which is a good thing. The question right now is that is this a change in the normal epidemiology of the virus, or about human behavior? And that's what scientists are really trying to peg down. Why are we seeing this disease outside of its endemic or the countries where we normally see it in Central and West Africa? Now, regarding the actual vaccine, the vaccine being released right now is by Genios, and this is there's about 1,000 doses reported from the U.S. stockpile, and it seems like the strategy is going to be something called ring vaccination, meaning vaccinating those who are in extremely close contact to cases, whether that's healthcare workers, people working in a laboratory, or very close contact. So definitely not a mass vaccination campaign.
Now, the CDC says that monkeypox can be transmitted through prolonged close contact and that anyone can get it. So what exactly does prolonged close contact mean in this case?
It has to be very close contact. And I think that's important for people to understand, because there's already the hysteria and misinformation highway taking off, comparing this to COVID-19. They are not the same. They're not going to follow the same modes of transmission. So the most, based on viral load, the way you're most likely to transmit monkeypox is through actual physical contact from the sores themselves or from body fluid. When we talk about that respiratory droplets, I was actually reading a research paper this morning. The respiratory droplets, in order to transmit monkeypox that way, you have to be in very close contact with someone who is actively coughing or sneezing. It's different than the airborne transmission we've seen with COVID-19, where the small little viral particles can float around in the air and go several feet. So you actually do need to be very close. And a little point of reference, there was one case last year, July 2021, of a U.S. citizen who traveled back from Nigeria and was around 200 other close contacts, and only one case was identified. That individual himself, none of the other contacts. So it is human-to-human transmission is not very likely.
How does this compare to the monkeypox outbreak in the U.S. in 2003?
Great question, because everyone's referring back to this case. In 2003, the CDC reported about 70 cases in the United States, and they were linked to imported small mammals, rodents, that then were able to transmit this virus to prairie dogs that were then sold as pets. Sounds kind of outlandish, but that's how zoonotic diseases can transmit, a disease that goes from animal to human. And in that situation, all cases were identified. There was a handful of vaccine given out to close contacts. And from what I read from the CDC report now, about 20 years ago, there were 2 serious cases, people who developed swelling of the brain, but no deaths. It was completely contained.
All right, so no prairie dogs identified here as far as I know. So how do we protect ourselves and our kids?
What we do is we pay very close attention to what headlines are telling us about what local outbreaks look like, and we do not panic, because as of right now, there has not been any cause of alarm by scientists or epidemiologists saying this is spreading out of control. The cases are being identified. Contact tracing is still in place. We just need to keep an eye out. Don't fall into the misinformation trap, and just stay vigilant.
All right, Dr. Patel, great to have you as always. Thank you.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.